Welcome, you're definitely in the right place. Today we're discussing a crucial topic, the potential link between zolpidem, a commonly prescribed sleep aid, and an increased risk of Alzheimer's disease. But don't worry, we'll also explore safer alternatives and steps you can take to protect your cognitive health. So, stay tuned. Understanding zolpidem, commonly sold under the brand name Ambien, is a widely prescribed medication used to treat insomnia. It belongs to a class of drugs known as non-benzodiazepine hypnotics, which are designed to help people fall asleep faster and stay asleep through the night. For many, it provides short-term relief from sleeplessness, offering rest during stressful or disrupted periods of life. However, while zolpidem can be helpful in the short run, health experts are raising concerns about its long-term safety, especially in adults over 60. As people age, their bodies process medications differently, which may lead to stronger effects or increased risks. Over time, regular use of sleep aids like zolpidem can potentially lead to dependency or cognitive side effects. That's why researchers have begun looking more closely at how this drug might affect brain health, particularly memory and thinking abilities in older populations. And what they found is eye-opening. The study linking zolpidem to Alzheimer's, a study published in the Journal of the American Geriatric Society, investigated the association between zolpidem use and the risk of Alzheimer's disease in older adults. The researchers found that individuals who used high cumulative doses of zolpidem defined as more than 180 cumulative defined daily doses, CDDD, within the first year had a significantly higher risk of developing Alzheimer's compared to non-users. Specifically, the hazard ratio, HR, for Alzheimer's was 2.97 for high-dose users compared to non-users, indicating nearly a threefold increase in risk. Potential mechanisms behind the risk. Although scientists haven't fully confirmed how zolpidem might increase the risk of Alzheimer's, several strong theories have emerged. One major concern is its sedative effect. Zolpidem slows brain activity to help people sleep, but this constant slowing may interfere with the brain's ability to form and store new memories, something called synaptic plasticity, which is crucial for learning and mental sharpness. Another theory involves sleep architecture, or the natural structure of our sleep cycles. Healthy sleep includes deep sleep and REM stages that help the brain process and store information. Zolpidem may disrupt these patterns, which can weaken memory and speed up cognitive decline over time. Lastly, some studies suggest that zolpidem might lead to an increase in beta-amyloid proteins in the brain. These proteins are known to build up and form plaques in people with Alzheimer's disease. If true, this could explain why long-term zolpidem use may raise the risk of developing this condition. Important considerations. If you're currently using zolpidem to help with sleep, don't panic, but also don't make sudden decisions. It's very important not to stop taking the medication on your own. Stopping it abruptly can cause withdrawal symptoms such as anxiety, rebound insomnia, tremors, or even more serious issues like confusion or seizures, especially in older adults. This is why medical supervision is essential. The best thing you can do is talk to your doctor or healthcare provider. They know your personal health history and can help you carefully weigh the risks and benefits of continuing zolpidem. For some people, especially those using it for a short time at low doses, the benefits may still outweigh the risks. But for others, especially older adults taking it regularly or in high doses, there may be safer options available. Your doctor might suggest a slow reduction plan or alternative sleep treatments like cognitive behavioral therapy, melatonin, or natural remedies. The goal is always the same: better sleep without putting your long-term brain health at risk. 1. Safer alternatives for managing insomnia. If you're looking for ways to manage insomnia without the risks associated with sleep medications like zolpidem, there are several non-pharmacological options to consider. These approaches focus on improving sleep quality naturally and can be safer for long-term use. One of the most effective and widely recommended alternatives is cognitive behavioral therapy for insomnia, CBTI. This structured, evidence-based therapy helps address the thoughts and behaviors that contribute to sleep problems. CBTI involves working with a trained therapist to identify negative sleep patterns and replace them with healthier habits. It has been shown to be as effective, or even more effective, than medications in treating chronic insomnia, and it doesn't carry the same risks for cognitive decline. In addition to CBTI, other options include sleep hygiene improvements, such as setting a consistent bedtime routine, limiting screen time before bed, and creating a calm, dark sleep environment. Relaxation techniques like meditation, deep breathing exercises, and progressive muscle relaxation can also help your body prepare for rest. Lastly, there are natural remedies, such as melatonin supplements, herbal teas like chamomile, or aromatherapy with calming scents like lavender, which may support a more restful sleep without the use of drugs. 2. Sleep hygiene practices. One of the most accessible and effective methods for managing insomnia, particularly for those seeking alternatives to medications like zolpidem, is sleep hygiene. This refers to a set of healthy sleep habits that can improve the quality and consistency of your rest. Unlike medications, sleep hygiene focuses on your lifestyle and daily routines, making it a long-term solution that promotes overall well-being. The first key practice is to establish a consistent sleep schedule. This means going to bed and waking up at the same time every day, even on weekends. Your body has a natural internal clock, known as the circadian rhythm, which works best when you follow a regular routine. By sticking to a set sleep schedule, you help regulate this rhythm, making it easier for your body to fall asleep and wake up naturally. Over time, your body will recognize when it's time to wind down for the night, reducing the need for sleep aids. Creating a restful sleep environment is another important aspect of sleep hygiene. Your bedroom should be conducive to sleep, meaning it should be cool, quiet, and dark. Studies show that a cooler room, around 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius, is ideal for falling and staying asleep. Eliminating distractions like noise, bright lights, or electronic devices will also help your brain associate the space with relaxation. Investing in a comfortable mattress and pillows can also make a significant difference in your sleep quality. Avoiding stimulants before bedtime is another crucial element of sleep hygiene. Caffeine, nicotine, and even heavy meals can disrupt your ability to fall asleep. These substances increase alertness and may keep you awake long after you've consumed them. Ideally, you should avoid these stimulants for at least 4 to 6 hours before going to bed. This also applies to alcohol, which may make you feel drowsy initially, but can disrupt your sleep later in the night, leading to fragmented rest. In addition to these practices, it's helpful to engage in relaxation techniques before bed. Gentle stretches, deep breathing exercises, or reading a calming book can help signal to your body that it's time to wind down. Mindfulness meditation has also gained popularity as a way to quiet the mind and reduce anxiety that can interfere with sleep. Creating a peaceful bedtime ritual, such as taking a warm bath or using essential oils like lavender, can further prepare your body for rest. By integrating these sleep hygiene practices into your daily routine, you can significantly improve your sleep quality over time. These changes are simple, natural, and can have a lasting positive impact on both your physical and mental health, making them a great alternative for those seeking to avoid the risks associated with medications like zolpidem. 3. Mindfulness and meditation, techniques that promote relaxation and reduce stress, aiding in better sleep. One of the most effective ways to improve your sleep naturally is through mindfulness and meditation. These practices are not only beneficial for reducing stress, but are also proven to enhance overall mental well-being, making them an ideal solution for individuals struggling with insomnia. Mindfulness involves paying full attention to the present moment, acknowledging your thoughts, feelings, and bodily sensations without judgment. It helps create a calm and centered mind, which is essential for falling asleep. By practicing mindfulness, you can break free from the cycle of worrying thoughts that often keep you awake at night. Instead of stressing about the next day or replaying past events, mindfulness teaches you to focus on the present moment, making it easier to relax and unwind before bed. Meditation, a practice that often goes hand in hand with mindfulness, involves focusing your attention on a specific object, sound, or your own breath to quiet the mind. It has been shown to reduce anxiety, depression, and other stress-related factors, all of which are common barriers to a good night's sleep. Regular meditation practice helps regulate the body's stress response, decreasing the levels of cortisol, the stress hormone, and promoting the production of serotonin and melatonin, two chemicals that support relaxation and healthy sleep. There are various types of meditation techniques you can explore to improve your sleep. For example, guided meditation, listening to a calming voice that leads you through a visualization or breathing exercise. Body scan meditation, focusing on each part of your body, starting from your toes and moving up to your head, while consciously relaxing each muscle group. Breathing techniques, simple exercises like the 4-7-8 technique, where you inhale for 4 seconds, hold for 7 seconds, and exhale for 8 seconds, can immediately calm the nervous system and prepare your body for sleep. In addition to these practices, mindful breathing before bed can be especially effective. Slowing down your breath and focusing on each inhale and exhale helps activate the body's parasympathetic nervous system, which is responsible for relaxation. This, in turn, reduces heart rate and muscle tension, preparing your body for deep, restorative sleep. Studies have shown that even a few minutes of mindfulness or meditation can make a big difference in sleep quality. As little as 10 to 20 minutes a day can result in a more relaxed state, making it easier to drift off to sleep and stay asleep throughout the night. 4. Natural supplements, gentle support for better sleep. Many people seek natural ways to improve sleep without relying on strong medications. Natural supplements can offer gentle support especially when combined with healthy sleep habits. However, it's always important to talk to your doctor before starting any supplement, especially if you take other medications or have health conditions. Melatonin. Melatonin is one of the most popular natural sleep aids. It's a hormone your body produces naturally in the evening to signal that it's time to sleep. As we age, melatonin levels can decrease, which might affect sleep quality. Taking a low-dose melatonin supplement, usually between 0.5 milligrams and 3 milligrams, can help regulate your internal clock and improve sleep. It's best taken 30 minutes to an hour before bedtime. Valerian root. Valerian root is an herbal remedy that has been used for centuries to promote relaxation and reduce the time it takes to fall asleep. Some studies suggest it may improve sleep quality in certain individuals, especially when taken regularly for a few weeks. However, it may cause mild side effects like headache or upset stomach in some people. Magnesium. Magnesium is a mineral involved in over 300 body processes, including sleep regulation. It helps relax muscles, calm the nervous system, and lower stress levels. Low magnesium levels have been linked to poor sleep and insomnia. Magnesium supplements, especially magnesium glycinate or citrate, may improve sleep quality and reduce nighttime awakenings. Chamomile and lavender. Chamomile is commonly enjoyed as a tea and is known for its calming effects. It may help reduce anxiety and promote restful sleep. Lavender, especially in essential oil form, can also be used in aromatherapy to support relaxation. A few drops on your pillow or in a diffuser may ease stress and prepare your body for rest. L-theanine and CBD. L-theanine, found in green tea, is known for promoting calm without drowsiness. Some people find it helpful before bedtime. CBD, a non-psychoactive compound from hemp, has gained popularity for reducing anxiety and improving sleep. More research is needed, but early studies show promise. Caution. Natural doesn't always mean safe. Dosage, quality, and possible interactions vary. Always choose supplements from trusted brands and talk to your healthcare provider first. Natural supplements can be a helpful part of your sleep routine, but they work best when combined with other strategies like good sleep hygiene, stress management, and regular activity. 5. Regular exercise and daytime activity, a natural way to sleep better. If you're struggling with sleep, adding a little movement to your day might be more powerful than you think. In fact, regular physical activity is one of the safest and most effective ways to improve sleep, especially as we age. Older adults who stay active often fall asleep faster, sleep longer, and feel more rested during the day. That's because exercise helps regulate your circadian rhythm, the body's natural sleep-wake cycle. It also reduces stress and improves your mood, which makes it easier to wind down at night. Morning walks or outdoor activity are a great place to start. A 20-minute walk in the sun helps reset your internal clock, making your body naturally sleepy when night comes. Sunlight in the morning boosts melatonin production later in the day, your body's natural sleep hormone. Stretching, yoga, or Tai Chi help relax tight muscles and calm racing thoughts. These gentle movements improve flexibility and reduce anxiety. Research shows that even slow Tai Chi routines can improve sleep just as effectively as traditional exercise. Light resistance or strength training using bands, light weights, or chair exercises can also help. These activities boost circulation and support healthy muscles. Over time, they improve overall sleep quality especially for people with chronic sleep issues. Stick to a routine. Try exercising in the morning or early afternoon. Avoid intense workouts too close to bedtime. They might leave you too energized to sleep. You don't need to become an athlete. Just 20 to 30 minutes a day, most days of the week, can make a difference. Start gently, listen to your body, and increase gradually. Always talk to your doctor if you have health conditions or haven't been active in a while. The key is consistency. It may take a few weeks to feel the results, but over time, exercise becomes a natural, drug-free solution for better sleep, improved mood, and a healthier life. If you find this information helpful, please like, comment, and subscribe Heals Integration for more insights on health and wellness. Also, share this video with friends or family who might benefit from this knowledge. See you in the next video. Bye.